our host for the day is a member of Parliament who very much believes in the work that we are doing, and he has been kind enough to be our chief host, and we would like to ask him to say just a few words about the UK government's position on eye health. It's my pleasure to introduce our host for the day, the Member of Parliament from Southend West, Sir David Amos. Sir David. Thank you, sir.
Now, is that a Canadian or American welcome?
I'm American, but
You're
the
American.
last speaker was Canadian. So
all right, okay.
Well, close that if that's in your
I'm
way.
sure no one knows who I am, but I am the Member of Parliament for Southend West, and for 10 years I was on the Health Select Committee. And during that time we had a number of inquiries into these issues. Little did I think that my own mother would be diagnosed with macular degeneration. Now, we got her to the wonderful Moorfields Hospital, but at her advanced age, it was really a little bit too late to do anything, so we sort of more or less given up putting the drops in the eyes, and she hasn't got much sight, although she kids us that she can still see the TV. But it is something that I know an awful lot about. What I say an awful lot about. No members of Parliament are experts in anything. We're all sort of amateurs. We exist to be blamed for everything that's wrong. And, of course, out there everyone thinks that we've got huge power to do things, but it isn't quite like that. But I've also got a sister-in-law who's only got one eye, and her husband is blind. So, to me, this is sort of the most precious of all senses. But my formal bit. Well done on organising this session. Age-related macular degeneration is indeed a ticking time bomb. In the United Kingdom, over 600,000 people are affected, and this, as probably has been said already, is expected to increase further with an ageing population. I have the most number of centenarians in the country, so I've got many people who had these problems diagnosed. Eye clinics, ladies and gentlemen, cannot cope with the number of people requiring monthly treatment injections to stop them from going blind. And I've seen that at first hand in terms of what we're able to offer in my own hospital at Southend. Whilst a great deal of progress has been made in healthcare generally, much more needs to be done. And so I'm told there will be a general election on the 7th of May, and all the political parties will be telling you that if you elect them to form the new government, healthcare will be much better. So my lot will also apparently be saying that as well. But specifically, I think that we do need your expertise in terms of early diagnosis for those people with macular degeneration. So, ladies and gentlemen, of course, more resources need to be made available to eye departments. And of course, there needs to be more joined up care and sharing of information between primary and secondary care across the country. But I would specifically like to mention the wonderful work carried out by private enterprises, for some people a dirty word, in this field. Aurea, who are sponsoring today's event, and we are very grateful for your sponsorship, have developed a new cost-saving and time-saving treatment for wet AMD. So I hope that the government will be able to support private industry to carry on with the research and development in this field and to bring about new treatments to the market in the United Kingdom. So in conclusion, I wholeheartedly support the 3 calls to action: to work to establish a national eye health registry to record all data from both primary and secondary care, to encourage the National Institute for Clinical Excellence Quality Outcomes Framework Committee to include AMD diagnosis and treatment as a clinical quality outcome framework indicator, and to work to increase government funding to enable a greater number of eye clinics to meet the recommended waiting time for initial treatment of wet AMD patients by January 2017. I end the case for the defence.